Okay. Well, we are here today for one more session of the preventive care grand rounds. And today we have a former student, a graduate for our program, from our program, and a famous one. Tracy has been a very successful story. She finished the program and also she did her nurse practitioner, and then she has done a lot of work for the community and has two clinics, non-profit clinics or free clinics in the area of San Bernardino and Riverside. She also teaches in the School of Nursing for National University, is that right?
Yes.
Yes. And then, so we are happy to have Trace here. She was one of our best students when she was in the program. And she also worked for us in Drayson Center Preventive Care. And now my assistant is Gio. That's why he is here. And Trace was one of the employees there on that time. Okay, let's have a word of prayer to start this session, okay? Heavenly Father, we thank you for your blessings. We thank you for Trace and for her willing to share her experience with us. Bless her and bless everyone during this presentation. Be present and give us the inspiration and motivation that Tracy has for us to continue and to start new ventures in terms of helping the ones that need help in terms of lifestyle, in terms of diseases, and mostly the ones that cannot afford. We thank you for Tracy to be with us now, and we ask everything in Jesus' name. Amen.
Amen.
Trace, please introduce yourself a little better, and then you can share your screen whenever you are ready.
Okay. Hi, everyone. I'm Tracy Dawes. I graduated from School of Public Health in 2014 with a doctorate in public health preventive care concentration. During my final year of that program, I was also enrolled in nursing school at Azusa Pacific. I did the combined RN, the BSN straight to the MSN portion over the next, I would say, 3 years. It's typically a 2-year program. So about 1.5 years for the first part. Well, let's say 3 years. It took me a little longer. I took some time off. At that time, I had a baby. And since then, a lot has changed. After I graduated in 2015, I started working for National University in their nursing department. So I am the course lead and content lead for community health nursing, which is basically public health nursing for the university. And we have 3 campuses, and I teach out of Rancho Bernardo, which is in San Diego. And on top of all of that, I also went back and got recertified. So I'm a family nurse practitioner, but I'm also a psychiatric nurse practitioner. So I teach, that's my full-time job. My other job is I run the free clinics, Well One Health free clinic, and which I started in 2014 when I was a student, the year I graduated from SPH. And then I also run private practice, psychiatric nurse practitioner private practice at the moment. So those keep me kind of busy. And so I am going to share my screen. So let me try to pull up my presentation. And it is going to be based on the clinics that we have. Although the idea is we'll present on nonprofits in general, all of the information here is suitable because I've presented this to other persons who are interested in starting a nonprofit. So even though it says a free clinic, that is what we know, that is our area of specialty. But I made sure to include all the areas for anyone who's interested in starting a nonprofit, because the steps are not different at all, just a few personnel, and we'll mention that as we go through. And so for our agenda, we're just going to give you a little brief history of Well One Health, and then we'll talk about the pieces that you need to have, the pieces of your puzzle in order to set up this organization. And then I'll have time at the end for questions. So Well One Health was founded in 2014. We started a nonprofit. I actually used students at the time. I was working at School of Public Health while going to school. And so my job was to place students in their internships for the program. And so I actually started this nonprofit utilizing 2 students who needed internship hours. And we continued to use students for the next 2 years as we got everything set up. We opened in 2015. We operate out of a Seventh-day Adventist church in the city of Paris. And currently we open on Fridays from 8 to 2. Don't have to make an appointment. We are there to serve those who have no insurance or those who have insurance as well, but it doesn't cover all the services they need. And if someone walks through the door and they have insurance, but they can't get into their primary care, that's okay. We see them as well. It's usually for a med refill or for an urgent consult. We do offer a number of services. We offer general medical services. We added pediatric services a few months ago. And we also have a dental clinic, but that has not been operational since COVID. But since COVID, we added mental health, and we're actually partnered with FEMA and the state of California to provide mental health services across California using peer counselors based around the state of California. Right now we have 2 locations. There was a time we had 3, 2 in San Bernardino, but one of them, every time we put a nurse there, that nurse would get hired. We can't be mad at that. We want our students to be hired. So, but since our programs or nonprofit runs on the back of students, we don't have regular volunteers really. And we were just for the first time able to hire a part-time clinic manager because we got a grant in order to fund some of these roles. So basically outside of that clinic manager, no one gets paid. We're simply there because we want to volunteer. And my students, my community health nursing students are there, as well as public health nursing students from schools around the area. Our second campus for our clinic is actually run by the UCR School of Medicine students. So I am their overseeing clinic. And so I'm considered a volunteer faculty for them to allow them to come in and run their clinic underneath through the auspices of our clinic. So we do not send nursing students there. That one is typically just undergrad students from UCR, as well as their medical students and residents and their physicians there. So my role is one, the founder, executive director. I serve as a family nurse practitioner, and because of our new mental health role, there are times when I have to dip into my psychiatric training as well. Especially recently, we have seen a great increase in mental health concerns. We have had to stabilize the number of patients because we have, unfortunately, nowhere to send them at this time. And I also consult with churches and other organizations who are desirous of setting up clinics as well. So let's take a look at what we talk about, the pieces of the puzzle, what you'll need. First of all, you have to have a clear vision as to what it is that you want to provide with your mental health. And you have to be clear about the need. Do you see a need? Because you may have a vision, but there also needs to be a need in that community for that vision that you have. And you have to be very clear on the population you want to serve and the team that you're going to use to implement your services. The other important thing is to think of your service area, as we call it, your catchment area.
These are really nice. They're very addictive.
It can be as large as you need it to be, or
There's
small
lots of
as you
things.
need.
There's apricots, peaches, and pears.
Dr.
And
Dos Santos,
also-
sorry, can you mute people? Since you're can you mute them?
Okay.
Thanks.
And then also take a look at your timeline and your service days. Have those in mind. All of these pieces will change as you go along, but it's important to have that in the beginning as a starting point. And of course, we're going to talk about the implementation steps today. So let's go through each of these pieces. First of all, you want to think about what is it that you want to do? Well, I pulled a few examples from free clinics in our Free Clinic Association here in California, which we are a part of. And I wanted to show you what the Simi Valley Free Clinic has as their mission. Now, if you notice, they say the mission of the Free Clinic of Simi Valley is to provide medical care, counseling, dental and legal assistance to individuals and families in need, regardless of their ability to pay. So they're very clear on why they're there. Someone then who goes to their website seeking aid sees this on their front page and knows, oh, these are the services that I can get there. If you look at Arlington Free Clinic, they're in Virginia, not much different either. We provide free, high quality healthcare to low income, uninsured Arlington County adults through the generosity of donors and volunteers. So they make it very clear, you have to be low income or uninsured, and you must reside in the county of Arlington. And it's important then in your mission and your purpose statement that you're very clear, because as you can see in Arlington, they mention who they serve, they mention what it is that they do, to whom they're giving the services, and how they're giving those services. And so that's the important piece. Now, you have to be clear on why. So the way to do this is to conduct what we call a community needs assessment. And in public health, we all do windshield surveys. When we started this clinic, we assumed that the need would have been medical services to the underserved community. And so we went with that mindset, but we still went ahead and did a needs assessment. And I just want to ask, anyone want to take a quick gander at what you think they asked for when we showed up? What did their needs assessment tell us that they needed? It was not medical at all. And it's the same thing that people call us now for. We get more calls for dental services than for medical services, because you can put off some medical services until it's critical. Dental, it's because of pain and loss of teeth. It's very difficult to put off those services, and they're more expensive and are rarely covered adequately by insurance. So that was actually, they asked for a dental clinic. We were not prepared at the time. We added one maybe 2 years later after we got a grant for that, but at first we could not. Define as well your population. Who will you help, but also who can you realistically help? Because as we're saying, if you're looking at starting a nonprofit and say, I want to provide dental services, you will find that there are a lot of people who need your services. If you come in that same area and say, you know what, I think I want to provide pediatrician services. Yes, you may find, but if there are other pediatric clinics, you may not find as many people needing your services. So you have to be very clear from your review and going to do your needs assessment, talking to community members, who is the population that needs the help, and be as clear as possible. In other words, do not simply say, I'm going to serve adults or children. Be as specific. Are you talking about immigrants? Are you talking about people with disabilities, the uninsured? Is there an income cutoff that you want to look at? Now, another good way to determine need when you're just starting off and before you actually do your needs assessment for your nonprofit is to take a look at census data. You can go on census.gov, look at the community that you're wanting to serve, look at county health statistics, call the county and find out. They also, each county publishes data each year on the health of their community. So look at some of these from previous years to get an idea of what the need is. And then another great place is the HRSA Data Center. They can point out what areas, for example, in San Bernardino are medically underserved, that has a health professionals shortage area, or a dental, they're dentally underserved. So those are things that you can do long before you actually make a decision, hey, I'm going to put my nonprofit here, do that background work. Now, one of the main pieces that you're going to need to do very early on, after you've decided, okay, this is the service I want, this is the people that I want to serve, this is the area that I want to go in. Your next best thing is to start thinking about your board. Your board of directors will be the guide, the overarching guide that helps to position the nonprofit and to take it into the future, so to speak. So a few things to consider. One, your board should not really be comprised of friends. You actually need people who are experts in their field or experts in the field that you're looking at setting up a nonprofit in. So if your nonprofit is, let's say, a food bank, then you're going to need someone who's really good with finance, because that is always important. You need a finance person. But you're also going to need, it helps to have someone like a nutritionist on your board. It helps to find people who are strongly into or that are stakeholders of the community that you want to serve. And it's good to have an odd number of board members for when you have a tie. And I've been told that and at first our board comprised of close to 10 people, and afterwards I was told you need to decrease the number. It's easier to work with a fewer committed people than to have a lot of people and they don't all show up. Now, you have to make it clear to your board that this is not a position where they're going to be financially reimbursed. And so they have to really be dialed in and are very serious about serving the population that you're interested in. Have them apply, vet them appropriately, and there are rules. You can find these on Google and like the questions to ask. And there are organizations that will actually do board training for free. It is also good to include one or two persons from the population that you want to serve on your board, because they're intimately acquainted with the concerns of the community. For example, we have now a patient on the board because she can speak from that point of view as a patient, what the needs are from her point of view. Remember to try to find a legal person, a finance person. If you're running a religious nonprofit, try to have a church member there. And of course, try to get someone from the city, a representative of the city on the board as well. And then, of course, outside of the board, you need that executive team, the boots on the ground team. So your executive director / administrator, in my case, it's the same person. And the different persons that are taking care of the different duties. So for example, in our clinic, we need a medical director because that's legally required. We need a dental director because that's legally required. But because California has a majority also Hispanic population, it was important for us to also get someone that would oversee translation services. And because we do a lot of community advocacy, we needed someone that was more of a social work liaison. And of course, you're going to need some specialists. So make sure you start looking at someone for fundraising, someone for marketing, definitely someone for IT, because in this day and age, especially with COVID, we have learned a lot of what we do is technologically related, and we need someone who's good at that. So where are you going to find these people? I knew where to find nurses. I didn't know where to find someone for IT. My husband helped with that, thank goodness. But where do you find people? A good place to look are associations, trade associations. If you're looking for doctors, call up the medical associations, the nursing associations, schools, because most students need to complete internship, they need to complete hours, and they have to be there because they need a grade. So they are a very committed workforce, if nothing else, for their grade. Look into finding retired personnel. I have gone through churches, I've gone to Facebook, I've gone to Instagram to recruit. And just putting the word out there has helped us tremendously. Now, also remember, you're going to need day-to-day people. I mentioned like your translators, your janitors, maybe security, depending on where you're working, and front staff and the back-end staff. So start thinking and making a list of all the people that you will need for your nonprofit. Then build your team out. Start going and asking these people, are you available? Would you be willing to help us for a year or two? Now, start thinking then you've got your board, excuse me, in place. You have an idea of what you want to do. Now, where are you going to locate it? Let's say, for example, you say broadly, I want to serve San Bernardino County. Well, it's a huge county. You can't serve all of San Bernardino at once. And if you're looking to say, okay, I'm going to start in the city of San Bernardino, well, it's best that whatever services you're going to provide are located as close to your city, in your city walls, or as close to as you possibly can. Start thinking, will this be a mobile location? Will you have one location or multiple locations? And start thinking, do I want to rent a space? Do I want to get a free space? Do I want to lease a space? Do I want to go to a church and say, hey, can I share your space that you're not using since you're not there every day? And there are organizations like the city can rent you rooms for as little as $1. And the dollar is just their commitment. They're not really charging you, but they just put it on the books that you are indeed leasing a space for $1. That's how many of our community clinics are actually run, or free clinics. They just say, just pay us $1 a year and we'll get you the space. A major thing to think about is how people are going to get to your location. So how accessible is it? Especially for those who are disabled. Do you have a bus route nearby? Is parking safe? Can they walk and can they get to the up to your location via stairs? Do you have an elevator? How will people who are disabled who are using a wheelchair access your nonprofit? And then if you want to have some ideas, I would say start looking at other places that are serving the same population you are. So for example, the church we're at already had a food bank. And so it makes sense then to put a clinic there because we had the population that we are interested in serving, those without insurance already coming to the food bank. By partnering with the church, we were able to use their space and pay very little because the people that we need to serve are already there. And so we decided to open on the very same day that the food bank is open. That way we're serving at the same time. So as you can hear then, location, location, location. That is very key. So now, when are you going to do this? First, build out a very realistic timeline of how you want to set up your nonprofit and when you want to actually start serving the people. Look first and foremost to make sure that your board is already set. And I'll tell you why that's going to be very important in a moment. Start thinking of the days you want to provide services. When we started offering services on a Sabbath afternoon at our clinic. But then what happens is we couldn't get all the doctors and the nurses because they're like, we're tired. This is our one day off. Sabbath is our one day off when we're at church and we don't want to do anything else. When we moved it to a Friday, we could get people who were retired, but now we couldn't get the doctors and nurses at all because now they're at work. And so we ran into those problems consistently. Sundays were a good day for dental clinic because then we could get the dentist on a Sunday. They would come. We could get the nurses on a Sunday. So you have to play with the days on which you're going to be open and if it works for the population. So now, let's go down to how we're going to do this. First and foremost, find an association and become a member of an association that is actually doing what you want to do. Do not reinvent the wheel. We reached out to the National Association of Free and Charitable Clinics. We didn't even know that they had one. California also has an association. We didn't know that either. We reached out, went, met with them, and became members, and immediate access was granted for any tools or grants, We got forms, we got people who were already doing it. We got linked into deeply discounted resource. And I'll give you a good example. Because we were members of the California Association of Free and Charitable Clinics, we were able to get discounted labs, and I mean deeply discounted labs for patients. The four most common labs when you go to see your doctor: CBC, CMP, lipids, A1C, and of course a urine test. Those without insurance will cost you over $400. It doesn't matter where you go. Without insurance, that's what our patients pay. That's why they don't get their lab work done. That's why they can't track their diabetes. They don't have $400 to pay just for labs when they need to eat. However, with Quest, because of our agreement as an association through Quest, my patients only pay $15. That's a huge discount from $400 to $15. $15 is way more manageable. And even then, there are patients that we help. So by becoming a part of an association, the minute you start saying, I want to set up a nonprofit, find out all of the associations out there that you can team up with so that you start getting resources. Now, so let's go again. We said you're going to get your team together. You're going to do your community assessment so you know what you're doing. You're going to put your board together. Your next step now is to start writing your bylaws. When we started, we had no clue what bylaws were. And so we went online, looked them up, and this is just the codified document of how are we going to do what we say we're setting out to do. We found one online and we modified it. And over the years, we have modified it as our services grew and as we learned more about what we wanted to do. You also need a set of policies and procedures. And again, you can find these online and modify those. Your bylaws and your board will be needed immediately because you're going to need to get nonprofit status in the state as well as federally. They're going to ask you for two things: bylaws and your board members. They want the names and they want the positions. So your bylaws, find it online, change the wording to go with whatever it is that you want, and you send that in to the state with all the people who are on your board and the positions. And the state only cares about three positions: who is your board chair, who is the secretary, and who is the finance person. They don't really care about the others. So if you don't have all the others, get those three and send that in to the state. And when you send that in, it costs maybe about $25 to $50 to send in that paperwork for them to give you your nonprofit status. That's all they need. You fill out their forms online, go to the state website, fill out their forms, send in your bylaws, and send in your list of board members. That's all they need. Now, of course, they need to know what your mission is, but you've already decided that. And that's also in the first part of your bylaws. And when you send in all of that, you sit and wait. You can also apply for the federal one in the meantime. The state one takes maybe a month or two to come through. The federal one takes about 3 months. And again, do not recreate the wheel. Find someone who has done this before. They will charge you up to $500, but find a nonprofit who has done this and can show you what theirs look like. And you just fill out your forms the same way. That way, you get it done 3 months. So in 3 months, you're federally qualified, but you're also state qualified. Or you can go for the federal qualification, do your bylaws, do everything, fill out the federal form, send it to the government. It costs $400 if you think you're not going to make any money for the first 3 years, or it will cost you $800 if you think you're going to be pulling in a good $50,000 and more in the first 3 years. So that determines whether you apply for the 400 or the 800. Well, let's say you apply for the 800 because you know you're going to kill it. You're going to do well. You're going to recruit and you're going to raise money. When you send in that paperwork, wait for 3 months. But as you're waiting, do not just sit around. Start doing the other things you could be doing, like building your website, getting more team members if you want to, getting the message out there that you're doing this work, getting the community mobilized and ready. Now, one of the things about nonprofits, many people think that when we talk about nonprofits, we're saying you're not going to have money, because we say nonprofit, it's a not-for-profit. A nonprofit doesn't mean that you're broke. Loma Linda University is a nonprofit. They're not broke. Sometimes we get close, but Lord knows we may teeter on the brink, but they're never broke. And it is the same with many nonprofits. They have very small income streams. So what we want to look at is how you can make money, because you have to decide that upfront. It's not just about having your board and having the team. How are you going to pay the lease on the space that you've gotten? How are you going to pay for advertising costs and any other costs that come up with, simple things as office supplies? How will you pay for this? Well, here's number one. For staff, use volunteers and students. That way you don't have to get regular staff members that you have to pay. Recruit volunteers, usually people who are very passionate about this. Recruit students who need internship hours. Of course, are there drawbacks? Yes, the students will graduate, they will move on. But if you have a contract with area universities, that's a steady supply of students. So don't know how to do accounting? Get an accounting major. Those students will help you. Get an MBA student, that's their field is accounting. They can help you. Do you need someone who will kind of help you organize everything? Again, get a business major. Do you need a social work student to help you set up your advocacy? That's the best way to go. Find people who are retired, find people who are passionate, find students. Now, if you want to have income coming in, you need to write grants as well. And there are grant software that you can pay for about $200 or $300 that will give you all the grants in various areas that you can apply for. I never took a grant writing class when I was at SPH. It was an elective. And I know I wish it wasn't an elective. And yes, I do write all the grants for a program. And yes, we have been successful in getting grants, but I felt I would have been a little bit more courageous in going after larger grants if I'd had that grant writing background. Do you have to go now and take a grant writing class? Not necessarily. There are free resources on edX and these free education sites that you can learn the ropes, or do a webinar, a free webinar on grant writing. Get what's called a DUNS number and a sam.gov access. And you can Google these because these come in handy when you write federal grants. When you write for federal grants, they want you to be registered with sam.gov, that's a federal system, and they want you to have a DUNS number. It's a way of tracking businesses in America. So decide too how you're going to raise money through whether you can do some social entrepreneurship. And that's as simple as having a thrift store that you're selling things, collecting items from your church and selling them. You can have a cafe on your premises. So start thinking, what can we make? Can we make t-shirts and sell? Can we get our names printed on water bottles and sell those to raise money? Come up with creative ideas out there on how you can raise money for your nonprofit. Another key way, outside of grants being the number one way, are fundraisers. This was our second year, this past year, doing a concert. The first year we made about $4,000. The second year we made about $6,000. And that went straight towards paying for lab work and imaging for our patients because our patients can't afford it. So we have a dedicated fund for lab work and imaging for patients. And it's funded from our concerts every year. Do raffles, sell tickets, do whatever you can, partner with larger organizations. The School of Medicine from UCR, the clinic that I oversee there, they actually partner, and we used to do this as SPH, would go to, let's say, a restaurant and say, we're going to drive traffic to you and you give us a percentage of the sales for that day. So then we'll tell all the students, you have to go to this one coffee shop or this one cafe, have lunch there all of this week, because between these 5 days, they will give us 5% of all their sales. And that's how they make money, simply by doing that. And they will make between, let's say, $80 to $200 for each event, which, since they don't have overhead costs because all their costs are subsumed under or nonprofit, all that money goes for them to hold for when they need to do something large for their organization. So it is very important to start thinking, how will we sustain this? Where will the money come from? Now, there's so many pieces, but another thing we just mentioned, the sustainability. You don't want it to fold if you leave. You want it to stay and prosper. So it's very important that you have buy-in from the community that you're serving and from the team that you have. Do not put people on your board just to fill board seats. If all you have are 3 committed people, go with those 3 committed people. Advertise, begin advertising. Remember, as you said, to set up your nonprofit, it is actually very straightforward. You go on, you Google where to find the forms on the government site, you fill out your forms, you find a copy of a bylaws, change some wording to make it match what it is that you want to do, fill out your federal forms, mail it in with the money, okay? Now, as you have done that, they will give you a name. So you came up with your name, and the government will say, okay, this is the name of your nonprofit. The minute you get those papers back saying you are official, now you can open a bank account. You can't do that before, because when you go to open a bank account, they're going to ask you for that information. What's the name? What's the federal or state proof that this is indeed your company? And of course, if you're operating, let's say, out of Loma Linda is going to say, well, we need you to have a business license. And to pay for that, you have your account from which you're paying for all of these. So it is very important then, from the very first day after you form your team, that you go ahead and set up and get your nonprofit status, because it'll take you about 3 to 4 months. And as that's being done, you're setting up your website. And as soon as you get the okay, you're good, set up your bank account and go full force, because now you can use the name publicly on social media. Now you can use it to advertise and begin fundraising. Start thinking of all the things that we have here. We haven't mentioned all of them, but we talked about the physical space. But recruitment of people, you're going to need someone that's all they do, recruit volunteers for you. Start thinking of all the materials you need. Do not buy what you don't need. In other words, when we started our clinic, we had an empty room. We had chairs that we borrowed and a table that we borrowed. We even borrowed a tablecloth. And we had a computer, or my own computer, a stethoscope. We didn't even have an otoscope at that time. We saved and bought a whole set for $500. In other words, we funded that clinic on less than $2,000 of the door. And now we're able to say, yes, we have 6 figures in the bank, because we have had to learn to go very, very low budget on everything. And the biggest overhead is your space. And the next one, the people who work for you. For any organization, overhead is space and people. If you can go down on those costs, decrease the cost that you plan to have to where you're going to be physically, if you can decrease that, do that. And if you don't have to hire, do not hire. Just go ahead and recruit volunteers. If you're running a clinic, you're going to need electronic health records. If any nonprofit you have, you need a website, and you need a way to track your volunteers. I built or own the website that we have, meaning I spend hours, but I spent no money, except to buy your domain. Get a student to do this for you. They're so creative. You're young people. The teenagers in your house, they know how to build a website. Let them build it. Let them set up your social media, and let them set up your volunteer tracking in Excel. Do not go buy the $2,000 software. So in other words, the important thing is keep overhead low. So here is your takeaway. The process is not difficult. It is not a difficult process, because again, the biggest pieces are the pieces that are done in the background. thinking of who you're going to serve, when you're going to serve them, why you want to serve them, and what service you want to give. When you have decided that, you get your board together, the 3 key people that the state wants, your board chair, they want to have a finance person, and they want your secretary who will record everything. After you get all of that, send in your paperwork, and as you're waiting, build out your team, find your space, do all the other things. Budget for a good 3 to 4 months to do this in. Can you do it for less? Yes, but the federal paperwork usually takes 3 to 4 months. So that's why we say that. It takes time. It takes time, but a lot of that time is built in on the back end where you're meeting your team and doing a lot of the planning. So your team is very critical. You need money, but not as much as you think to start off. So begin with the things you need the most. The $800 for the federal filing fee, and everything for the state is less than $100 for the state of California. So what we did, we budgeted $2,000, and we were able to stay within budget because we didn't need to buy anything that we could get for free from someone's garage. You'd be surprised. There was a dentist that had like 3 almost new dental chairs in their garage that they just wanted to give away. People's garages and these places are a trove of treasures. Don't buy what you don't need to buy. Save the money for when you will need to spend it. Come up with your policies. If people need to be licensed, get them licensed. Free up yourself to focus on the things that are most important. And don't forget to get everything insured. Your space, your clinicians, all of that are the big pieces that you need to take care of. If you can get this done in 3 to 4 months, then the rest of the time you are just building out one service at a time, one policy at a time. Recruit as many people as you can to help you get there. We were able to build our free clinic. We were able to get all of our paperwork done in 3 months. But overall, we couldn't say that we had a clinic for about a year, because while we had volunteers, we didn't understand all of the pieces that we needed to put in place. We didn't have a space. We didn't have any of those. What we have here is just a snapshot of the big pieces that you need to put in place. I am happy at any time if anyone wants to discuss these further, feel free. Dr. DeSantis knows where to find me. Reach out, and we're happy to help you get your nonprofit off the ground. And I'll stop here, and if you have any questions.
Thank you, Tracy. It was very interesting, and let me put my face here. It was very interesting and very motivating for us. When you mention about recruiting money or making campaigns, I remember one time that we made a deal with vegetarian Happy Family Restaurant Vegetarian here in Dresden.
Yes.
And then for a month or so, they could go there, and then a percentage will come to our clinic. And then one day I told my assistants, okay, I will pay for you to go. And I gave $20 to each one, and they went there and they spent the money there. So my expenses were $40, and then when I went to the restaurant, they gave me $40.
Those were the only ones who went.
But anyways, the experience was interesting, because it's not only the money in our case, but it's the promotion in the community. So they keep knowing that, okay, there is a lifestyle clinic. In our case, there is a something going on in Dresden. So maybe we go there, or we are open for that.
Yes, the advertising is very important, and it's easier and more cost effective now to do it by social media, because so many people use social media. So and it's basically free. It's basically free.
I will start with one question. We have one preventive care specialist that she didn't hire anybody to do clerical service. She did all automated. What are your experiences with that?
So there are so many things that we can automate. If we're just saying by clinical services like blood pressure and the clerical. Oh, so for us, we use students. We could not afford to hire someone. And so we just reached out to the universities. We reached out to medical assisting programs and, those certificate programs, and we only use those persons. It is a way, and let me compare it to my psych practice. My psych practice is virtual, I literally just got someone to help me for the first time after we've been around for more than a year. Why? Because people are the greatest overhead, people and space. And so to cut down on that, I did all my clerical work myself. I answer the phone myself and I have it automated. If you don't get me, you can text this number, you can leave a message, you can reach us through you go to the website, send us a message. There are at least 5 different ways that we can be reached. That way you don't have to use a clerical staff if you don't need to.
Thank you. Anybody else has any question for Tracy?
Yeah, hi, Tracy.
Hi.
Great presentation. I learned a lot, and I have a question about naming your nonprofit. Can you talk a little bit about that? What goes into a name?
So I tend to use names that people are, but then I say, there is Google and there's Zoom. Do not tell me that my name isn't good. So our nonprofit, for example, is Well One Health. And the idea around that is it links into our purpose. We believe that everyone is deserving of good health. Everyone should be well. So we said, Well One, everyone should be well. Now for my psych practice, the name is Ubuntu Health, which is a word. It's a word in the South African language, in one of the South African languages, the Zulu languages, that means that all people are connected. So when something goes wrong with you, something goes wrong with me. And because it's a mental health practice, we wanted to show that we are standing with our clients. So when we're looking at a name, we're looking at the purpose. Here are the guidelines out there in the world of naming. It should be easy to pronounce. That is not always the case. They say to use real words as much as possible. But then we have seen so many companies in the last, I would say 10, 20 years, like Google. They're not real, they're made of words, but they're also catchy words. There's also the belief that you should start with something that is close to the top of the alphabet as possible, because it helps, it's easier for it to find you. Okay, so that's why most people will say A something or B, go as close to the top as possible. The truth is, you don't even need to do that anymore, because with social media, what matters most is how easily people can find you. And it's not just about the alphabet anymore, because it's about what we call search engine optimization. You getting your name in front of as many eyes as possible matters more than whether it starts with an A or not. So my belief is tied into your passion. When people see the name, it should be easy to remember, and it should be catchy enough that your target population can say it and pass it on quickly to another person. Also be very careful that the word that you're using is not offensive in any language that you know of. I don't know if you guys ever heard this. Was it I think it was a Chevy Nova. And for those of your Spanish speakers, Nova means it doesn't go. And so they had a hard time penetrating Hispanic cultures, populations, because the people say, why would we buy a car? You tell us in the name that the car doesn't work. So the Chevy Nova never took off in those countries.
And Nova.
Yeah, Nova. They
Nova.
heard it doesn't go, it doesn't work.
Thank you, Tracy.
Anybody else? You have to unmute yourself if you want to say something.
Tracy, that was really, really interesting. This is Lisbeth Fernandez. Just had a question for you as far as what kinds of ideas did you have initially to do a nonprofit? What were your initial thoughts?
So I'm going to be really honest with you. A part of it was a selfish motive, and I'll tell you why. In 2014, I was about to graduate from nursing school and also graduate from the DRPH program, but I was also heavily pregnant. And if you know the world of nursing, well, most fields, I think, but definitely nursing, floor nursing, they take one look at you and said, we're not hiring you when you're about to give birth. It's just not going to happen. So there was no way for me to get a job. And I needed the experience because I wanted to be a family nurse practitioner. My passion is not hospital nursing. My passion is community public health nursing. And so I decided, well, if that's what you want, why not go directly there? And the only way to do that, because I couldn't, no community clinic wanted to hire me either because I was pregnant. So I said, okay, then start your own. Get the experience you need to go back and serve the community you say you want to serve. And my belief is that healthcare is a human right, and that just because someone is undocumented, they don't have money, shouldn't mean that they can't access healthcare. So that was where I came from.
You may think it was selfish at the beginning, but it was very serving the community in the end.
Yeah, that's where I wanted to go. That's where I wanted to go. And I said, if this is the only way I can do it, then this is what I'll do.
Great. Congratulations.
Thank you.
I don't call it selfishness. I call it survivalish.
Survival instinct indeed. Yes, I agree.
Do you think, Tracy, that one could develop this free clinic and survive only with that as a professional?
You know what? There are those who do that. And I can tell you this much. When I started, I knew what I wanted to do. Okay, it's going to be a free clinic, but I didn't see it as a business. And this is 2014 when we started. It wasn't until 2018. We struggled a lot because it's hard to recruit volunteers outside of students, especially on a Friday, because people are at work. And I remember leaving clinic one day and having a conversation. And I do believe that there are a few times in my life that God spoke so clearly that I had no doubt that that was God. And I was driving home, and what I heard was, you treat this place as if it's not important, but this is a ministry. It is just as important as the church. This is my ministry, and you need to see this as a business, as if you were running a real business. And I came home and said to my husband, I never saw it as a business. I saw it as something, I had a job, and this was something I was doing on one day per week, for my community. When I changed my mindset that it was indeed a business, that's when things changed. That's when we started writing grants. Or federal contract right now is worth over $1 million. I never thought that I would ever see anything like that for a free clinic. But by changing my mindset means I start seeing it as a place where we could hire. And now we hire 46 counselors across the state of California to do COVID mental health services. It can be done, Dr. DeSantis. It takes careful planning, and it takes a team. But you can get to the point where people are being paid from this. But you have to start by assembling that team, number one. And number two, immediately start looking into streams of funding, grant writing, but on top of that, having some kind of social entrepreneurship, meaning sell something. Many of our clinics have a thrift store on campus. They don't make a lot, but $20,000 has helped to, take care of some overhead and at least pay a few people. It is difficult at first, but it's not impossible because some of our free clinics take care of everyone there. All the people who work there are fully paid in our free clinics, some of our free clinics.
Thank you. Another question is, do you remember the struggles when you were in preventive care and the reason that you went to nursing school? Because once you finished with preventive care, you didn't have any kind of license to deal and to practice. Now we are asking, things have changed a little bit. So
yes,
our preventive care specialists, they take the health coach, and health coaching is being recognized by the American Medical Association as the new profession in the block. And then, do you think there is space for health coaching in one of your clinics that is free clinics?
We do. We use, and because we have mostly nursing students, a part of our nursing profession is that we teach nutrition. We teach, and I teach lifestyle. So the principles that I learned and that I grew up with as an Adventist and that I learned at Loma Linda are a part of my public health curriculum. Because I am the lead, I wove those into our syllabus. It's a part of our program. It's built in. So they do learn about Loma Linda. They do learn about or the way that we live, healthy lifestyle. And as nursing students, they have to learn that. So yeah, we currently use nursing students to do that. And I've had two nutrition students from Loma Linda who have worked at our clinic. One just took her boards, or she's taking her boards right now. And the other one was when we first started. So yes, we do have space for that because Dr. Gio is here. Dr. Gio ran our diabetes class, and I think this is his last week, but he has been with us for months running our diabetes class. And it's not just telling them, oh, eat less sugar. The diabetes team does a very comprehensive lifestyle approach. So we always, in fact, he leaves this week as his last week and we have no one else to take over. So if you have anyone to send to us to volunteer, unfortunately right now that's a volunteer position until we can get it refunded. Yeah, we are very open to that. And I want to say a quick word on this. You mentioned the struggle. When I started the DRPH program, I was very aware that it didn't have a license. And when I went online looking for jobs that required that license, that degree, I couldn't find any, which told me that they wouldn't pay me any differently from someone with a master's in public health. And so coming into the program, I already knew I was going to pursue a license to go with it. I chose not to do the RD because again, I went to look at the salary range and the scope of practice and compared that to nursing and realized nursing was way broader. And for the same amount of money, why not just do nursing? Because most people don't realize that if you already have a bachelor's degree, when you go to nursing school to do your BSN, you're not doing 4 years, you're only doing a year because you already have, all you're doing are the nursing courses, which takes about a year of clinicals and coursework. So that's what I did. And I don't regret it. I think that was the best decision I made, combining nursing and public health.
Thank you. You are right on track. Even though, if the health coaching goes to mainstream medical system, the payment, the reimbursement is not gonna be that high also. It's gonna be lower than the dietitians for sure. And it will take a while until it gets to get a little more than
like established.
Yeah.
And
the
I would tell people then I'm not against the health coaching because we do need it, but unless it's reimbursed. Remember, that kind of reimbursement at first, as you say, is very low. And if people pay cash, they have to pay out of disposable income, which means it's a wealthier population that you'll be pulling. And if your heart is to serve the people like I serve, you wouldn't be able to serve them because they wouldn't be able to afford your services.
Yeah, that's another point that I was going to say, but in a positive way, because many preventive care students, they would like to open their own place, and they somehow didn't have the license to do that, but now they can. If they have the health coach, they can go con health coach and have a higher, because of their education, they have a higher level of health coaching that they can offer as services. So,
Yeah.
well, we are still to see what is going to happen to the profession, but it's new. But the other thing is that the students don't have the depth that you had when you finish the course, because we drop a little bit the units. So you don't have the loans that you got when you finish, or I don't know if you have loans, but my students have loans over 100,000 in the past, and now is much lower than that. So that's another thing. So you don't need a big job or a job that to repay loans is not that hard.
Right.
Okay, any other question? Any other I didn't make the connection between Jill. Jill was always in Paris and talking about the Parents 7 Day, and I didn't realize that he was with you there.
Yeah, he was with me, and it's an amazing partnership. They have done great work to rebuild our diabetes program. We closed it during COVID because almost all of our diabetics are over 50. So, and they were the group we didn't want to come to clinic. So we kept our clinic open through all of COVID. We only closed for about a month, but we closed our class, in-person class, and reopened when Dr. Gio came a few months ago to reopen for us.
That's great. Let's see if we can locate someone else. Thank you, Gio, for the good work. Okay, I think we are passing our time. Thank you again, Tracy, and we want to really appreciate that and tell you that we will use this information for sure. It was a long time that I want someone to talk about this nonprofit business. How could we start? And I believe, besides the information that you share, what is more important is that you share the possibility to contact you if someone is interested in that, and that's good.
By all means, and they can always come if they want to shadow us at clinics. Some people we have people now, especially on our board, who are interested in starting nonprofits. So we give them a board position so we can groom them so they can do their own in a few years.
Okay, let me stop. I think I should have stopped recording.